마이크 테스트. 하나, 둘, 셋, 넷. 마이크 테스트. 하나, 둘, 셋, 넷.
안녕하세요. 드디어 혁명 세션을 시작하게 됐습니다. 참석해 주셔서 너무 감사합니다. 보통 첫 세션에 사람들이 제일 많아요. 항상 아쉽게. 그 뒤에가 더 중요한 내용들이 많은데, 그래서 와주셔서 너무 감사드립니다. 그리고 많은 질문 해주셨으면 좋겠어요. 영상이 한 40분 정도 되는데, 수제는 폭스가 8시에, 우리 시각으로 8시에 접속이 가능하거든요. 그래서 시간이 떠서 그 사이에 질문을 좀 받아서 여기 화이트보드에 붙여서 여기 통역해 주실 이소은님이 오셨거든요. 네, 그래서 이분이 이제 통역을 해주시고 질문, 그 답을 직접 듣는 시간을 갖도록 하겠습니다. 이분 영상 보시면요. 거의 듣기 평가 수준으로 너무 진짜 깔끔한 그 감탄하실 거예요. 그리고 저희 것 때문에 되게 천천히 말씀을 해주시는 거예요. 정말 듣기 평가가 좋습니다. 자막 작업을 한 땀 한 땀 해주신 우리 이진솔님을 생각하시면 생각해 주시면서 그러면
Hello, my name is Susanna Fox. I'm a healthcare and technology strategist based in the United States. And I recently wrote a book called Rebel Health, a field guide to the patient-led revolution in medical care. It was published in 2024 by MIT Press. And it is my honor today to address this group and share with you some of the lessons that I've learned about how people are able to take control of their health and respond to the needs not only of themselves, but of their communities, particularly when the healthcare system or the government is not able to meet their needs. People turn to each other. So, I'm going to be talking today about how to step into your power as advocates. You may not realize it, but you are part of a long line of revolutionaries gathering together to support each other, to advocate for change, and to shine a light on the path forward. Health rebels fill in the gaps left when policymakers either do not see or refuse to serve the needs in their communities. When nobody is helping, health rebels turn to each other. I'm going to begin with some of the history of the patient-led revolution in the United States. And I hope that these stories resonate with you and you can think about the history in your own country of people who turn to each other for help when the needs are not being met by the government or by the healthcare system. So I'm going to begin by calling forward the spirit of Alcoholics Anonymous, known in the United States as AA. It was created when two people who were living with alcohol use disorder in the state of Ohio in the United States realized that they could step forward together and join together to try to stay sober, to try to not drink alcohol. And they took each day, one day at a time, and that became the motto of the group. AA is a peer-to-peer mentoring network for sobriety. It is one of the most effective and least expensive programs available for people with alcohol use disorder to moderate or quit drinking altogether. The next example happened in 1948 when people living with serious mental illness decided to start gathering together to reduce the social isolation experienced by themselves and their peers. Fountain House was founded in 1948 and has transformed the way the world sees and treats people with mental illness, helping to alleviate both social and economic isolation. In 1971, the Black Panther Party created a peer-led initiative. It was led by people in the community to test Black people in the United States for an inherited disease called sickle cell anemia. It's a genetic disease that was thought at the time to be found predominantly in people of African descent. The Black Panther Party filled in a gap left by the government because no one in the government was tracking the prevalence of this disease. Thanks to the awareness brought by the Black Panther Party's innovative data collection effort, $500,000 was allocated to sickle cell anemia research in the National Sickle Cell Anemia Control Act of 1972. The Black Panther Party also brought together scientific and medical expertise, and they combined it with what we call lay wisdom, and that is the wisdom of patients and survivors and caregivers themselves, to create a network of clinics and health workers who could deliver care where and when people needed it. At the time, racism had held people back from seeing sickle cell anemia as a priority for science, medicine, and public health. And the Black Panther Party was able to change that by collecting data and proving that it was important. The next example was when a virus was sweeping across the world in the late 1980s and early 1990s. And because it first appeared, the illness first appeared among gay men, it was stigmatized and ignored by many people in the scientific establishment. So members of the AIDS Coalition to Unleash Power, which is the acronym for ACT UP, they formed a nonprofit to push pharmaceutical companies and the federal government to develop and test therapies for HIV by forming peer-led coalitions, educating themselves, and establishing their credibility. ACT UP and its allies won over scientists and policymakers, creating a partnership that fundamentally changed biomedical research practices. A lot of the advancements that were created in the 1990s, thanks to those citizen scientists, are now in practice today, standard practice at our FDA and at the US National Institutes of Health, as well as at pharmaceutical companies. We all stand on the shoulders of these giants. You are joining this proud tradition of peer-to-peer healthcare and advocacy, the patient-led revolution for better healthcare. So, how do we keep this revolution moving forward? That is what I'm here to talk about. I am a researcher who focuses on the intersection of healthcare and technology. Early on, I got advice from my mentor, Tom Ferguson, who urged me to spend time in online patient communities, particularly among people living with rare disease and life-changing diagnoses, things like serious mental illness, HIV, ALS, cystic fibrosis, and diabetes. Even back in the 1990s, pioneers were building the missing infrastructure of healthcare. They were weaving a net of information and data and creating tools to save themselves and anyone else who needed help. The very first report that I wrote about health and technology was published back in the year 2000, and it was titled The Online Healthcare Revolution. And now, more than 20 years later, I published a book titled Rebel Health, a field guide to the patient-led revolution. I want to note, however, that it's only because I didn't have space on the cover of the book that I was not able to also include other important people who are part of the revolution. The book title includes the words patient-led revolution, but I want to call forward the fact that survivors are a huge part of this revolution. This is also a survivor-led revolution. And I'm addressing so many of you today who are survivors. And I want to thank you for going back into the fire to try and save more people and realize that you yourself know the way out of the maze that other people are stuck in. There's also another group of people I want to honor, and that is caregivers. This is also a caregiver-led revolution. People who care for their loved ones are the infrastructure of our healthcare systems all across the world. It is often unacknowledged work. It is often unpaid work. And yet caregivers have that loved and lived experience that policymakers and corporate leaders can learn from. I also want to address another part of the title, and that is the word revolution. Why did I pick the word revolution? Well, because what else do you call a grassroots uprising by frustrated people who suddenly get access to the tools and information they need to solve problems and demand change? Revolutions are built on communication. The printing press helped build political revolutions. In our country, the American Revolution was fed by pamphlets. These were folded up pieces of paper that could spread ideas and lay out a vision for a new country and connect people spread over great distances. The internet is helping us to build a healthcare revolution. But there's more to it than simply access to information. There's something special about the way people are creating new pathways to health and well-being, the way we are learning from each other peer to peer about how to collect data, how to our own goals. Often hopeful, but also often angry and frustrated. Seekers